So, good afternoon, everybody. Good afternoon, Amit. Good afternoon, Rajita. Thank you for spending a valuable time to be with us and to share your insights on the ever changing scenario on the employee demands and the healthcare association. I wanted to spend 5 minutes to draw out the key salient points that we would like to pick your brains on and any other points that you would like to drive home for the audience here today. We have seen the engagements for employees change dramatically over the last couple of years. Some of them were driven by macroeconomic needs. Some of them were driven by competitive features. Some of them were driven by a transformation that we have seen leading organizations like yourself take to align corporate OKRs and employee OKRs together, wherein we have started moving from an ROI to a value of investment perspective. The second change that we have seen is that on one side, we want to standardize benefits that we want to give to the corporate, to the employees. But we still want those benefits to be personalized and customizable for each and every employee. And these are technically counterintuitive. So to personalize a benefit and still have it standardized across the board brings in a very different level of complexity and how are organizations such as yourselves handling that. And third, from your employees, is there a preferential order of benefits that they see that you have come across, that is there something better than the other that they come and keep asking you? So is your priority right now to go deep? So with this, I would like Rajita to maybe take question number one. So what have your priority benefits been over the last 2, 3 years, and how have they changed as you have?
Thanks, Arpit. Before I get to what we've done, I want to highlight, the top five risks for people in Asia in 2022 based on the Mercer Marsh report that was published, right? Number one risk was cybersecurity, data privacy. Number two risk was pandemics and communicable health conditions. Number three was administration and fiduciary. Number four was about catastrophic personal life events. And number five was benefit, policy, and reward decision making and accountability. So if you see, not just for us, but across the globe, and if you just focus on Asia, the continent where we are at, benefits and health-related things have been the priority from that standpoint.
Mhm.
And the government of India also in 2020 had introduced a lot of what would I like to call it policy relaxation and allowing for healthcare providers, insurers, etc., to add more products which could be sold in the market, which would benefit at the end of the day any life, any living being. While it was great from that standpoint, I think one of the things that many of us did not notice was that care was shifting from the hospital to the clinic. Not everybody goes to a hospital today because now you have virtual doctors, you have telemedicine, you have all the good stuff. And then from the clinic, it moved home, right? Like, so for example, I know that we used Apollo, so I'll take that as an example that Apollo was providing home consultations for anybody who was detected of COVID with visits, with tests, with medicines being provided. And they had also tied up locally with a vendor who would provide for that kind of food that needs to happen during the pandemic, right? So availability 24/7 and access to care was more driven from a mobile phone. So now I don't have to go sit in front of a doctor and do it. What did we do? We as a company are, we've been in the BFSI domain for the last 65 years. So typically, our approach has always been wait, watch, don't make drastic changes. So what we did was slowly get into the inclusion aspect of it and also look at based on the emerging issues that are coming on healthcare, introduce those as part of our insurance policies. Or if different products were available, buy those and of course roll out programs in case of an unfortunate situation where you have a death of an associate or a family member. We rolled out a program called Sahai, which was fully funded by Broadbridge India and things like that. So at a high level we did a lot of things, but coming back specific to insurances, we opened it up for partners, not necessarily only for different genders, or it could be same-sex partner or otherwise as well, depending on what you declare. We also came up with care on COVID specifically, and we also came up with allowances for associates. So at a high level, those were those three differentiating changes that we did for that.
So could you elaborate on allowances that you're saying you shared for the employees?
Sure. So what we did is we said that if you are, COVID positive, and obviously the joke was we want everybody to be positive when you come to work, but not COVID positive. So when you're remotely working as COVID positive, you get an allowance of an X amount depending on how many number of days or weeks you actually have been impacted by
All
COVID.
right.
That's point number one. Point number two, what we also did is we provided for leaves, and leaves were COVID caregiver leaves were pandemic off, leaves were COVID if you're self, and also things like recuperating and coming back to work. So these were like 4, 5 type of leaves that we introduced specifically during this time, and we continue to keep them. We're calling them well-being.
Very, very well succinctly put. So, Rajita, there's one more metric that we noticed in 500 odd corporates that work with us, and this was during COVID specifically. That while they were tracking attrition, they missed out on the loss of productivity due to absenteeism. And for a lot more corporates which were geographically distributed, such as yourselves, it had a similar or a larger impact because those were employees who were performing at peak who did not need to be onboarded. And the corporates were just not ready with the right amount of data because most of the healthcare that came during COVID was reactive. And this essentially created a new class of medicine which was called emerging diseases, right? So from a reactive health wherein you seek a telemedicine doctor because you call a doctor when you know that there is an ailment that you need help with. Very few people actually proactively call a doctor before they don't really know what they need help with, right? Then with chronic diseases, when you have diseases that can be managed over a period of time, they need to be controlled within therapeutic ranges. And then emerging diseases, which you don't know whether they'll be sporadic or they'll now live with you for a longer duration. So, for example, I had COVID, it left me with an ailment which will trouble me for a longer time. There were people who went on scot free, there were people who had loss of limb and life, and so on and so forth. So, there were AI based data analytics that came out of it to essentially create interventions and then help larger organizations break their workforce into smaller decision making cohorts. That female age group between 30 and 35 at a specific location in this department are potentially suffering comorbidities between condition 1 and 2. And here is how you can fix it. Because you cannot have one size fits all. You just cannot roll out one engagement for a employee count that big, and those small cohorts then became manageable groups which benefited from social engineering. They were communicating within each other, there were teams created, there were gamifications done, they could keep each other abreast of how they are improving, which actually added to the benefit. So Amit, I would like to request your opinion on the same question.
Yes, so pretty much, Rajita covered all. But then, I would take it as a pre-COVID and post-COVID eras in terms of, healthcare benefits and how the whole ecosystem evolved, and it changed everything. So one thing which I observed during that, so pre-COVID, it was all reactive, as you would know, kind of, okay, fine. If you have something, you will go see a doctor and then find whatever it is, you get treated. But post-COVID, and I'm negating between the COVID wave because that ultimately everybody has a challenge and they dealt with it. Post-COVID, it had become more proactive, right? People are more conscious about that, health, of course, is the wealth. The mantra became more prominent within the circle, within the mind of employees, because the struggle we saw was really the life struggle people were having. And then between the COVID, as you said, that infrastructure was very, very bad in few of the countries, and then there were not enough supplies you could manage. We as a company tried to help the way we could, but there were essentially nothing we could get on. Let's say, for example, we wanted to procure oxygen cylinders, concentrators, but there were no supply. Even if you're like okay to pay rocket price, even then it was not there. But then what? Lives were suffering. People needed that. So that kind of situation, when people saw, they made the thing that something has to be done about it, that you don't go to that stage where it's just like total helplessness and chaos everywhere and there's nothing to look out for. So as a corporate, what we did is we tried to build that whole system around it, that even if it comes, you are ready first, right? So what it means that we made sure that any pandemic like this comes, let's say first, second, third wave. So second wave was really, really drastic. So we were prepared for the third, fourth, fifth wave as well if it comes here. And fortunately, it did not reach to the level. But then This is one change when companies adopted, that they became ready for any contingent situation to come in, not only to have them survive or go with the productive level, but also to help their employees. So when they need it, they are ready, right? So that's what everybody had more concentrated purchase, oximeters, medicines, doctors on panel, and then about the cylinders or whatever. So that infrastructure made it. Second thing came, which is, I would say, was not before that. We used to focus on healthcare when we talk about is insurance, but you give them, you get the admission and that. After COVID or during the COVID, the insurance is healthcare insurance is not just about the admission. It's all about giving the holistic care, be it your mental well-being, be it your being on the social well-being, and your, of course, physical well-being. And then the mediums were provided that OPDs were included in benefits which were operating. So we had tie up with many of the OPD platforms which could give consultators. As Rajita was saying, you don't need to go to doctor to see your consultation. Let's say if you feel some symptom, you would be little kind of, let's say, lazy or hesitant to go and say, fine, do I really need to go and see doctor and take my hour away? No. So these platforms work wonders because the ease they brought in to have a consultation done was phenomenal. Plus, the yoga sessions were done online just for the being, and then there were many initiatives taken by corporates like us who prompted a proactive wellness or health being for employees, rather than saying, okay, fine, if it comes to the stage that you are ill already and then you take something. So these are the few changes came pre-COVID and post-COVID, and it's some kind of companies are continuing with the benefits best of it. So we are continuing with the one which we feel should be one in the long run helps general well-being of our employees, so as the workforce remains healthy and happy. And that's what I think we continue to do. And those are my takes, other than Rajita. And last thing I want to add, we all companies tried, but then very few were able to get those resources. But in their capacity, let's say an example, we introduced unlimited leaves. So there was something that we were not even bothered about, that do you really the work is not, because every company was struggling or every individual was struggling for a life. The work takes the back seat. And in a difficult time, if you are not standing with your people or your workforce, there is no point you being there and telling that you care about people, right? So that's what I think changed the mindset of people as an employee or as an employer, that there is a greater cause, that you both work mutually for one aim. It's not making profit. It's not something that you are here to bring your daily KRAs and finish it. Yeah, Rajita, sorry, I kept on the floor. If yeah, please say.
No, I actually said, before I forget, I want to add on to what you said. I mean, very beautifully said. And you spoke of productivity, Arpit. Companies such as ours did not focus on productivity because for us associates, life was more important than anything else. So there was no specific productivity metrics put in place. For people to apply for work from home, those kind of systems were taken away because we trust people, we want to show them, we empower them. So we did not do any such thing. And on the contrary, productivity actually was much better than what it would have been, So
And that's exactly what I wanted to have you say out loud. That I lived in Finland for 5 years, and Sana Marin came in as a young 35-year-old female prime minister, and she tried really hard to get a 4-day week going. And they did enough surveys to say that if you give people 4 days to finish what they're supposed to, they'll finish it off in 4 days. If you have them do it in five, they'll take 5 days to do it, because there is a human psychology which says that I have that much time to do it. So why is there a pressure to accelerate? Rajita, this brings me product. This let's put productivity in a different perspective, right? So you guys rolled out holistic, comprehensive wellness programs to the employees, and they were best in terms of peer group, in terms of cross industry group. How did you evaluate employees response on individual programs? Did they come back to you with some programs that you did which they love, which they said should continue and go deeper in, some which they said that our dependents, for example, will also like to participate in? And is there a feedback mechanism over there?
I'm going to give you an analogy, Arpit. We all, for a living, on a daily basis, depending on our, schedules, we either eat 3 meals a day, 2 meals a day, or 1 meal a day if you're into intermittent fast. What you eat as part of the meal totally depends on how you're feeling that day. Okay. So the feedback cannot be a happy based feedback or something like that. That today I like this yoga session, like Amit said, Tomorrow I like the other Zumba session that happened. It was great. My family participated. We did something else for kids. People were happy. So our mechanism was also holistic. It was not at one particular, what do I want to call it, initiative in specific. So
Hmm.
our theme overall was SOS. SOS essentially means signs of success. And we also told people that, you don't have to brag about success every time. It can be a sign of stress also, right? So you can move from the stress to eustress depending on how your workload is, how you're feeling, and things like that. We did pulse surveys every 6 months. I know there are AI enabled bots that give you the pulse on a daily basis and things like that, but we very consciously did not deploy any of that because
Hmm.
we said that while I could feel a particular thing today, like right now I'm on the session, the minute you talk to me at 6 o'clock, I feel a little different. So
Hmm.
it's that I don't want to get into that bind, but I want to look at consistency with regards to what is benefiting me. And based on that feedback that we received, every single thing that we rolled out was very, very appreciated. And I don't want to take credit for the design of the program or the rollout or the people who we engage with. I want to say that the mindset of people changed during this time, which is why all the gratitude that came out was, earlier it's my right, you got to do it for me. And now it was like, no, I'm grateful and thank you for considering. And I think that's where it came from.
Brilliant. I mean, and it's a excellent feeling that what you rolled out really worked out for you. It's very heartening to see. Uh, what we saw with some of the corporates that we worked with is essentially a price point and a service line comparative. And there are organizations, say for example, are distributed across India, and the benefits that they want to roll out are around Pancha Tattva, right? Like you said. So physical, mental, spiritual, and financial as well. So there were guys during COVID and otherwise who were covered with insurance but had certain amount of payment that they had to make out of pocket. And just to put that in perspective, on an average, India Inc. Individuals spend around 15,000 rupees annually, which includes basic consults, medicines, off the counter, and so on and so forth. And there were people who were not blessed who couldn't afford that amount of money. So we introduced financial programs for them to get small financing done. We were essentially able to work with corporates to help them customize programs in 30,000 possible ways, which is what you very, very rightly said you guys did. And they were tailor made essentially to demographics, they were tailor made to geographies, and they were tailor made to basic thing in healthcare, which is what we call a risk assessment. Because delivery of any wellness program, whether it is physical or mental, it starts with a benchmarking, it starts with an assessment of where that individual is. And that assessment, when completed, nudges that respective individual employee to go back and seek help. That is what we automated. So, Amit, how was your response from employees in terms of the benefits rolled out? If you could share some perspective on a couple of different cities, if employees reached out to you with different demands, and how did you handle that?
Yeah, so Arpit, I would say it's the geo-wise it's very different. As it goes, not within the country or intra country, but then if you go to the geos and continent, the healthcare system splits very differently. So let's say comparison to I will take three examples. Like let's say India, North America, and Europe. All three geos work very differently. How the healthcare is provided. To start with, in Europe, you say the expectation employees are not even worried about the healthcare. Why? Because everything is a state sponsored, and that means it's beautifully sponsored that you don't need to worry about anything. Since yourself you lived in Finland, I assume that there was ever any instance that you have to shell out single penny. But
Yeah.
when you were mentioning about the copay concept, it's a very prevalent concept in North America. So there are plans which, and in North America, the healthcare cost is substantial. It's a very significant part of a employee benefit, unlike India, which is not that significant. So if employer even wants to go full blown on terms of the maximum health benefits, it puts a dent on the kitty of benefit kitty which employer has to provide. So then their concept is okay, copay, and then employer asked to do that. We, as an example, in the company which I last worked, had allocated a certain cost. Okay, fine, we will put this amount of money to your plan, and this is the basic plan we can offer. Over and above, if you want to opt anything, this is what you need to pay from your pocket, right? This is how it works. And eventually, healthcare system and the way doctors work is also very different. So that's North America. But then coming back to India and telling you that expectation wise employee, it's very, very critical juncture. How? Because healthcare costs in terms of, let's say, 1,000 people company, if you talk about and take a plan, there are many factors. Forget about the copay, because that's a good corporate. And the analogy, as we talk about, you go with the Maslow's need hierarchy here as well, because when corporate grows, they are just away with the hygiene costs, as talking about that. Okay, we need to save penny here and there. No, the focus became more towards the happiness of employee and employee experience, you call it. So you would not worry about few dollars here and there, but you would worry about the maximum benefit you could get, right? Of course, you can be a cost conscious, but then eventually you want to drive the maximum happiness from that experience or benefit to that employee. So what we look forward to is that, of course, if there are 5 players and who have put the quotation for X benefit, what is the maximum evolved benefit, and what are the additional drivers of that benefit as a healthcare which is given to us. So I will go over, even if I have to pay premium, to choose the one which is best suited to the needs, right? So let's say few of the companies are hesitant to cover old age group, right? For me, it doesn't matter to me, because employees' parents are equally important to me, because if something is not well in family, your mind and soul remains there. And then why would what would you do of your insurance you have only covered, or your spouse covered, when rest of your families are still struggling? So that actually mindset is changing. Even insurer, or the kind of the mediators who are coming, they are factoring into the whole complex scenario evolving, that it is a benefit which affects the whole family, not one individual. First. Second, the cost is not the only parameter which corporates take to decide that what benefit you want to take. Third, are what value add services you are providing in your insurer. So is it just not, we don't want to hospitalization as just only benefit. So it has to be many things coming across. As I was saying, it has to be by your OPD, it has to be your lab test, wellness test, a holistic annual comprehensive family suggestion, dietitian plans, your dental cover, and 100 of different things. So these are the value adds which now is making a significant difference for me to decide that what insurer plan I want to buy. Cost is really the secondary. And then even if you go, the cost is only 10% variance, 10 to 20% variance in any of the plan you choose. If you go with the national companies or the private companies, it just a small variance which doesn't even matter. For employees, it matters that what opinion it. So we as a company, as you were asking, the perception is changing from the cost to value add. And from the employee side, I want to add is, yes, they want to include everyone from their family, from the parents. And earlier it used to be very insignificant amount, like 2 lakhs, 5 lakhs, right? People are now conscious because the room rent is tied to your plan. Let's say if you want to take a single occupancy room, and if and you are just 5 lakh cover, so your room would probably be capped at around 6-7,000 at max. So you are kind of just hanging by the thread, and then you are paying over and above from your pocket. So employees are becoming educated, so what to suit them best. And that's what I think we are also working as a corporates to align with what matters most to our workforce, and which is more aligned to the ever-changing time post-corona for our employees.
Correct. Actually, very well put. Because insurance is a risk product that you take, which you don't really want to ever use, right? I mean, it's a product that people have now started realizing is a necessary evil that you have to spend the right amount of awareness and money on. Let me emphasize on awareness, because you rightly said it's pennies on the dollar between the average program and the premium program. What are the changes, Amit, that maybe top two that you want to drive additionally in the organization going forward basis your experience, specifically since a lot of employees who are working from home or co-located are now coming back, relocating to offices? So that physical proximity in itself is inducing a lot of stress and anxiety. And so how are you gearing up to tackle that?
So yes, most of the corporate have those engagement programs, Arpit, and this part of this problem and issue, which you think it is covered from that perspective. But we as a corporate, I would say that we have a well inbuilt platforms where we make sure that our employee experience remain at the top priority for us. So it's just something there are programs run on our digital platforms before employees started coming to office. But now, since they are coming, first of all, collaborative learning culture takes your much of the stress. This 3 years or 2.5 years when Corona was on full scope, people missed out to what they were earlier taking as an evil, right? So they were missing the same thing which they were cursing before, that why do I need to go office? But
Right.
after being stuck into home for 2.5 years, the majority of our rock stars came back. When are you opening office? When is okay? Fine. It's they don't want to come every day, but then they do want to come, because what they are missing is the collaborative learning culture, and that's kind of compensates to everything else. And of course, there are sanitization issues, which of course, would be addressed in terms of that educative initiatives, that do and don'ts, and kind of people are more aware about the hygienes of basic you need to take in order to remain healthy and happy. Sports, I
Mm-hmm.
think, has evolved very much. We
Right.
had, as a company, volleyball court, badminton, every court we had, but I did not see people coming and using them. Post corona, that is the most demand thing, because ultimately, being occupied in this, they wanted to enjoy the life as well. And that I don't want to like kind of over exaggerate, but I want to touch that the value of life, I think, has improved. People started understanding that no, this is a very small time we are on this planet Earth, and if we don't take the full every day at it goes with the full joy and happiness, what else is there? You would keep earning, you would keep accumulating the wealth, you would have just more zeros in your account after certain amount, because it's a notional value. But life is just one, not notional. It is something you live in that particular time and second and minute or hour. You say, if that is lot, is lost. So I think that has come as in kind of more prominent in mind of our people or a general public, that do go out, live fully, enjoy the life, and then just take care of yourself the way you best can. And eventually, this is all matters. This is all what matters, that if you can walk, you can enjoy. If you're bedridden, what's the point of having those zeros on your account? So this is what I think, my 2 cents on it, and then I will pass on to Rajita to take care of rest of which I missed, or any new perspective on that.
That on a very happy note. So, Rajita, I keep saying mentally connected, yes, socially distant. So, what is your advice to the other corporates on this scenario with employees coming back? So, what is the advice that you, as a very employee centric company, will like to give to the other people who are following?
Arpit, I will answer it back with a similar thing, saying that highly aligned, loosely coupled. Okay,
Okay.
so if people, I know we spoke of engagement, and I've done a lot of research on what engagement is. I think it's not about engagement; it's about purpose-driven organization, and it's about aligning with that purpose of the organization. And if the organization prioritizes me, because if I say talent is key to me, I need to walk the talk, okay? And I would walk the talk doing several things, not just related to healthcare. And if I'm able to showcase that to my associates via communicate, it's a very small, little, and a very simple thing that we expect all corporates to do. But then many times we take it for granted as well, wherein you leave it. So I think focusing on those things is going to be very very critical for organization. Additionally, I know everybody talks of technology. We're a fintech organization. I think standardization of the data captures what is going to make things a little different for us, right? So if you use predictive analytics with regards to what you're coming up, which associate will like what. Previously, you spoke about clustering people, based on their ages or based on the geography and things like that. I would actually say that use the HIF approach, which is hindsight, insight, and foresight.
Mm-hmm.
We've always been working, and somebody beautifully said it to me last week. Said if you're driving, don't keep looking in the rear view mirror all the time. You're going to look in the front, and the rear view you're going to use very, very minimal. So if you're talking of the future, and if you're talking of now, like Amit said, focus is on the now and what's ahead. So having the foresight of using data to advantage is what's going to make the difference for any organization.
Excellent. So I hear personalization, I hear empathy, I hear employee centricity. I hear productivity as a new metric, which talks about not only work but an overall employee slash organization well being. I hear employees and organizations connected at the hip to collectively moving towards a common goal. I hear change of priorities from reactive care to holistic wellness, which is beyond health. It includes wellness, it includes financial wellness. So, for you as fintech, a social impact, or the underbanked community which you guys have. What do you think as a community should be our collective endeavor as priority one for the next 12 to 36 months in the short term, both in terms of service seekers and in terms of service providers like us? What do you think should be our collective alignment towards?
Do you want me to go first or do you want
Yes,
Amit?
yes, please.
Okay. It's a little contradictory when you say collective and when you say from seeker and from service providers. I think collective is for both together. So I'm going to consolidate both and tell you what is in my head. The thing that we should be looking at. I think one is we've been talking of awareness. So increasing the awareness of what's happening on the healthcare front, how things are shaping up. I think what's also happening is, the way you have the used to have the Ubers, the Olas, the Zomatos, the aggregators. You need aggregators also possibly in this field. While some of you do like I know Econ Care does do some kind to that extent, but I think maybe a lot more detail on that front is what an organization and an employee will benefit, because if I get everything at one stop shop, and it also predicts for me where I need to go, what I need to do. It's going to be very, very useful. I think in addition to that, what's also important is people have become, like he said, said people are focusing on living now and want to be fitter. I think they also need to have accessibility to what are the things that they need to do for themselves. Like, we used to do pre-pandemic health checkups that were sponsored by the company, and they were discounted, for family members if they wanted to go. And after 40, we had mandated a check for everybody, right? But now I think 40 as an age group is not there anymore because life is unpredictable across ages.
Right.
So things like that essentially come out from your standpoint, using what the industry is moving to, how it's happening is what's important. I think also coming up with niche product. So today, when people want to do a lot more on the room rent, right? Because at the end of the day, I think there's a huge sense of pride when people say I come from the corporate sector versus the unorganized. And there was a and it's a bad example, but there was this video on WhatsApp that was doing the round wherein the guy is selling samosas to a guy and he says, Sarji, samosa khaoge? And I'm going to speak in Hindi, because I think the essence will come in that. And the guy is standing over there and he says, हाँ बहुत बढ़िया है samosa, भैया कितना हुआ? Then he asks him, भैया कितना कमा लेते हो दिन का? बस यही 5, 10, 15 depends. ओहो वो तो बहुत कम होगा. Then he says, 100 मतलब 500 रुपए 1000 रुपए वैसा नहीं नहीं सर 25,000 तक मैं दिन का कमा लेता हूँ टाइप 5-10 हजार दिन का. एंड देन ही आस्क्स हिम कि आप कितना कमाते हो, तो वो बोले कि हम तो भैया 25,000 कमाते हैं महीने का. Then he goes and tells him, then there's an instant change where when the guy is there and this guy says भैया अगर कोई मिले तो मुझे बता देना, हम 30-35 हजार देने के लिए तैयार हैं महीने का. So this guy is sitting with him and saying please मुझे ले लो type. So the reason I call that out is that there is a huge sense of pride in people who are working in the organized sector, and they want to show that they can afford healthcare, good healthcare for themselves and their family, right? So we have actually rolled out top-up plans, modular plans, platinum plans, where I can sign up even if my company is going to say, for example, 10 lakhs, okay, of coverage or 5 lakhs of coverage, including family members. I can go up to 50 lakhs because that is available. So you need to essentially give the flexibility for people to do it. There was, their introduction of EWA, that's early wage access. You spoke
Yeah.
of monetary help that companies need to do. Not every company wants to give a staff advance, right? Because it's on the book. So if you provide for that kind of flexibility, tell me all the 20-30 things that are there and let me pick from there. One last call out that I have is many insurance providers are not in touch with what is the latest technology that's been introduced. So if
Right.
somebody is going in for a bypass, right, and robotics is used, it's not covered as part of the insurance policy because IRD is not, approved it. While I understand we have a structure and guidelines to follow, but if people can get creative and allow for people to use things like that, it's going to be a hit both for the service provider and the employee. So those are my 2 cents.
Actually, if I just need to say yes to most of it for my sales pitch to happen, but uh, let me put it in an analogy form as well, right? So aggregation, absolutely, that's what we do, right? And while that brings in incredible economies of scale, which results in both commercial fiscal benefit. But what it brings to your table is a flexibility to choose from a wide array of partners, which is otherwise just not viable. So, as we speak today, we touch close to 2 million lives with 500 corporates. And at any point in time, on a monthly recurring basis, like you said, health checkups, we conduct roughly 50 odd thousand health checkups a month. From a sheer number perspective, that is higher than some of the largest service providers in India. You very, very beautifully put that the insurance players, the largest of them, are still not in touch with reality because their systems are archaic. They have not woken up to a new reality of how to underwrite risk because they don't have supporting data to do it. What has happened in healthcare in India in the last 5 years, especially with the sovereign insurance product being introduced by government of India, is that the top lines have shrunk and a lot more procedures have gotten included in the life-saving category, a cardiac procedure, a plant, and so on and so forth. And a lot more cancer drugs, for example, have been included in the life-saving category, which puts top lines of significant players at risk, and they don't know how to react to it. The only way for them to react is to participate with us on the supply side, which in turn helps you. And this has to be stitched together beautifully through a technology platform on two fronts. For the champion who will govern and run this for his company or her company, or for an employee who will still have the beauty to look customize it for himself in 30,000 ways. Because, like I said, my needs at 40 male are different than Amit's need and your need and dependent's need. What we have also done and we are toying with is we're playing a little hard and loose with this word dependent, right? Dependent as a concept got defined from the insurance companies, and they said that a commercial dependent on you is we say that a dependent is anybody who can impact your well-being. My brother, who's a year younger, he has a I have a significant impact on each other's well-being. We take care of each other. We're doing fine in our own spaces. So he's still a dependent on me and vice versa, even though we are physically interconnected. So we say that you include five people who impact your well-being, whose well-being you want to impact, and you have them avail the same level of benefits. It doesn't really need to be a parent. It doesn't really need to be a spouse. It doesn't really need to be a kid because a lot of people in the diaspora that you and I work with don't really have that population. They're too old, wherein their parents have taken board and they're not married, so they're left with one or two people actually seeking benefit. So Amit, what would you say would be top one, top two things that you want to champion or take deeper in the coming year?
So, okay, I want to visit back the same, discussion we were having in terms of, the how things are evolving, and what Arpit, on the same line, what I feel there are many things we as a corporate want to be included, and the personal experience as well, as Rajita was also saying that aspiration are changing. Lots of that time see that the game is just between the TPA and hospital, right? Employee is just the mercy of either of two. This is something a very I'm talking in the context of India because that's where we are talking. That I feel has to change because the fairness and the transparency in whole process is just very opaque. I don't know what's happening behind the curtain. All I have to do, okay, fine, request the TPA to send the form and then call up the insurer to get the bill approved or give the pre-sanction or whatever it is, and then it takes ages to get the approval. The whole process is very lengthy, not transparent, and kind of I would say it's full of discrepancies, which make your whole experience really you wonder that what's the point of having this kind of insurance which you make you stay 5-7 additional hours in the hospital because sanction did not come, money did not come, there's no visibility, you have to run just from the patient's ward to the TPA ward time and again. This is one thing I want to change as a HR plus as an individual, because the whole experience, the patient experience needs to improve. One very critical thing, as you said, that what needs to be changed. That is one thing. Second, what I see is, it's a kind of more flexibility in terms of how the insurance has been taken. As I said, okay, fine, I want to take top up, I should be free about that. There should be no
Yeah.
capping. If I want to add something, the range is mine. I want to, if I'm able to do that, let me allow to do that. Okay,
Mm.
and then how the total things in terms of what to be covered and not covered is now more regulated than it's required, right? So
Yeah.
it's earlier, I understand there are controls and checks in place because people were manipulating, and there are always some bad fish in the market to to spoil everything for you. But then there are sincere people, and there are general public is the honest public. You need to
Mm.
work in a better interest of the general population, but that did not happen. So
Mm.
everybody is looked upon from the eye that they would do something fishy, and that's how
Mm.
it's the Indian healthcare system worked. When we talk about especially the insurances, has gone to I would say the drain. So as this looks very disturbing to me from the experience void. Second thing I want to tell you is that when you take insurance, you take that you never use it. The tendency is that no, it's the being is this. No, God forbid, nothing happens, and then you never require that. But if you require that, that policy should be able to work for you. Most of the
Correct.
cases, Arpit, I've seen, the underwriters come with some clause to negate that claim for you.
Mm.
Most of the cases, there are hardly any cases which are smooth. Say, okay, fine, you do that, fine, your claim is passed and do. So here the tendency of underwriters is to reject and then let you prove that the claim was genuine. Whereas it should be, as the developed countries work, that fine, you give the claim, you have it processed, and then if there is something, you claim back. Because at
Right.
the time of problem, somebody is already struggling. You are putting more pressure on that individual or poor soul to prove that onus that yes, this claim is good. So these are
Correct.
few things, from perspective of HR, I want to improve upon the experience side, the transparency, fairness, and when you need the policy, it should work. It's not that you have to run pillar and post to get it. It has become more towards a system which is more deep rooted into the kind of as I said, the proven guilty but not not proven guilty, all that concept. So that's
Mm.
how my take, Arpit. Let me know if I can add anything
I,
on that.
I think this is a very good point. Though we have just started helping corporates with insurance, it has not been our primary area of interest for the last 7 years. We've just started about getting into it in the last couple of quarters. But you have to look at, I'll share with you two perspectives. So we work with 50 odd companies now, the smaller ones who we have helped with on the insurance piece. A couple of interesting insights that I would like to share, right? So you mentioned TPA. The interest of the TPA is not aligned with the corporate, it's aligned with the insurance company. So any time wherein a TPA comes into the engagement, his primary interest or his source of revenue is for the claims to be rejected, and that's what he will insure. So what you're saying is a valid problem, but we're walking into it knowing that that happens. There's another player called a broker who sometimes participates. And essentially, his objective is to help you reduce the premium that you would pay year on year. And that would be done when the entire health checkups for top management and the organizations are conducted so that the risk profiling goes down and basis that a risk underwritten results in a lower premium value. None of the corporates that we were speaking to actually paid lower premium at very minimal claim ratios because the health checkups that came to free were so basic that even if they were done, they were not entertained by the insurance company who were pushing them or peddling them as a freebie to be viable enough to reduce up headcounts risk score. So these were essentially just check boxes, right? So what we have done is we have reached out to a couple of large insurance companies. We are trying to come forward with a simplified approach wherein we become an intermediary and the principals work with you through the technology platform that we provide. And what you said that the moment a claim is submitted, it becomes somebody else's problem is the way it will be. So we will take some time to come back to you and finish this off, maybe a couple of months or so, maybe next year. But we want to start this only after the people that we have spoken to have integrated our technology. Otherwise, you'll still have manual claim submission forms, you'll have people making mistakes, You will have people speaking to each other on the phone, sending wrong email IDs with attachments. And it's not a problem that cannot be solved without either intent or technology.
Right. Okay, good, great. But then, no, Arpit, I'm sorry. I have to, with just like 10 minutes left in the engagement, I have to leave something for very urgent came up. But I think Rajita would cover me for last 5 minutes. Rajita, you're okay with that?
Sure, no
Okay,
worries.
great. But then I enjoyed this session. For the last 5 minutes, you have to pardon me. I'm really, really sorry. But anything
Absolutely.
for me, but no, I'm all in. And then nice meeting you all. The lovely audience. Thank you very much. Take care. Bye. See you.
So since we have a hard stop at 3, at 4, why don't we open up to the audience if they have questions which they would like to ask Mr. Jita?
Sure, we can.
So I don't see a chat.
I presume there are no questions because I do see the chat and there's nothing in the chat box.
So, Vijit, I actually wanted to finish off my thought on the insurance piece, right? I
No,
mean,
go ahead.
actually, an interesting point that Amit made, and this is one of the important cartels in India, so to say, and pardon my. One of the ways to break a cartel is to become a larger cartel. That's something that we have been toying with. While I am still saying that insurance is not our primary area of interest today because it's a much tougher problem to solve. The other flexibility and the benefits that you spoke about, we have a patent technology platform. And what that helps with is essentially it helps you tweak the benefits that you want to run in 30,000 ways. And that doesn't necessarily mean that those benefits need to come from the aggregator platform and their service providers. If you have 18 needs, let's say, for example, and you have 15 service providers that you're very happy with, they can continue. And additional 2 or 3 service providers that we would bring on the board get onboarded. And the technology platform typically gets extended to everybody. So you get a unified view, your employees get a unified view. They don't have to bother about multiple applications. There is no hard and fast rule about zero sum game.
Yeah, so I agree with your thoughts. So are you asking me to comment on that or
No, I just wanted to make an
okay,
insight on the insurance
sure,
piece.
sure.
And on the telemedicine piece, I think one of you guys said that we have seen an increasing trend about reception over there. We have actually taken a step back and we have brought basics into the play over there. What we have brought forward is a concept called family doctor, if you remember that happened in our previous lives, right? My parents are surgeons. And quite of us like me who are medically illiterate, if I have a problem, I don't really know which doctor to speak to. And at 2 o'clock in the night, typically when I'm reaching out through a telemed, I need to see a familiar face in a fast response time who would then give me basic triage and let me know whether I need immediate medical attention or not. Because 9 out of 10 queries made to the medical practitioners, the GPs, late in the night are out of anxiety. Only 1 out of those 10 require attention, and that's what those people do. And that is a team that we've built in house to ensure that there is quality assurance. So we will wind up in case if there are no other questions. Rajita, the floor is yours.
There is one question that has come in.
Yes.
Arpit, sorry, and I will read it out. It is mental health versus productivity. It's something everyone talks about, but not all employees, not all companies imply in the system. How to solve this, considering more and more health issues and other problems are rising drastically due to unhealthy work pressure. So, and maybe I'll take a stab at it, and Arpit,
Yes.
feel free to add. I think it's a very real question because that's what happens in some companies. But you know, if I narrow it down and call it out, more than productivity, I think it's about unreal deadlines and expectations of people, because of which people take too much onto their plate, saying that I need to deliver this. That's what ends up becoming as a problem. So a couple of things, right? I don't think this is a healthcare issue. I think if we look at it, it's more of a leadership issue, it's more of a cultural issue, and it's more of how the organization's wired and what are the systems, processes, and procedures with regards to how everybody is expected to respond and react in a situation. I know that during COVID it was extremely unhealthy, and there were a lot of conversations, right, when all leaders said, "I just washed my vessels and came. I played a game in the drawing room and I broke something with my son and I'm coming to the call," and things like that. But the unsaid thing that, even if you have this, I'm saying I'm flexible, but I expect you to be on the system, on Zoom or on Teams or on WebEx whenever I call you, adds way too much pressure. I think it's about maturity, it's about ambidextrous managers, and also getting more and more, it's called something which asynchronous communication into being at workplaces, and that's what's going to solve for it. That said, it is an evolution. It will not happen overnight. It will not happen in a year. It will take at least 3 years for you to see a change like that in an organization. And you need to start taking baby steps towards it. The first step is going to be let your leaders assess themselves, understand their biases first before they get into leadership roles. Second is for associates, create open platforms of communication in-house. I know nowadays people like to go to social media and express themselves more outside than inside. I think it's only fair to give a fair chance to your employer in-house. Tell them what's happening. If it still doesn't resolve, feel free to go and express whatever you want. But that is something that you need to give a fair chance to. And the third thing is, if there are things that the organization is doing only from one aspect for whatever reasons, and you have a better idea, come share it. I can assure you every organization is open today and wants to make the change. So that's my answer on that.
So while we wait for the next question, Rajita, your thoughts on you said this is a leadership issue and this starts at the top and the leaders need to walk the talk, right? We were talking about, and it's a fun question, right? So I had, and I instilled this in my team, and my boss did it to me that we'll have no meeting Fridays, and most of the meetings actually then happened only on Fridays because everybody knew my calendar would be free. So what preached actually practiced, and not only in your area of influence of what you saw as a practicing champion of the community. What did you see? What is being preached actually being practiced?
Um, so Arpit, I just kind of finished my thesis. I was doing, I am doing PhD from XLRI. My
Hmm.
topic was corporate hypocrisy.
Okay.
So when you say things like that, you hit the nail on the head, right? And corporate hypocrisy is not new. It's not because of the pandemic. It has been in existence since 1950s, and at times there are certain papers that go back to 1920s as well. So,
Right.
to your point, how does it work? I think it exists. There is good, there is bad, right? And there is good, there is evil. So if you were to kind of balance it out, I think organizations need to become more aware of what they're doing on that. If I give you an example at Broadridge, I've had a mixed, thing. Some leaders literally followed the talk. I will not ping you on Saturday, Sunday. I will not ping you on Saturday. But because they're so used to it, they came up with a coping mechanism for it. The coping mechanism was, I will still log in on Sunday. I will type the mail, but I will schedule it to go out on Monday morning. Okay. And then there were things that people said, I will send you something on Friday night at 5 o'clock. See, it'll only take 1 hour, just finish it and go. But actually it takes 6 hours. So moving out of that to something like, okay, I will send you a mail on Friday. I will not ask you to come back to me on Monday, come back to me by Tuesday, but I've given you enough heads up. So it's more about discipline, it's more about conditioning, and it's more about, you need to understand from a leader standpoint also, right? They all lost the power slash control in a hybrid model. I
Yeah.
don't see all my workforce. How do I influence them? That is still being discussed, debated to death. So, and I don't know if you follow, but there are these two people who are a part of Homo, which is an organization based out of US, and they come up with memes. And the latest meme that they came up with is the horrors of hybrid work. Okay, and it's brilliantly put in a cartoonish format. So I think everybody is learning, but the intent is not to be hypocritical. I think it's just that they don't know how to go about it. So it's going to take time, but it won't happen. And I think we are up by 1 minute.
Yeah. So, guys, in case if there's no other question for Mr. Rajita, I would like to thank her on of all our behalf. Rajita, thank you so much for spending an hour with us and sharing your insights. They were incredible. I look forward to being in touch and taking some of these discussions forward.
Sure. Thanks,
Uh,
Arbet, and thanks, you observe now.